Awesome. Thanks everyone for being here. If you are here for a press briefing with frontline workers and public health experts on global vaccine access and its impact on Washington State, you're in the right place. We're going to go ahead and get started in just a minute. Thanks everyone for being here. If you are here for a press briefing with frontline workers and public health experts on global vaccine access and its impact on Washington, we're going to get started in just a minute. You are in the right place. Awesome. Cool. So I think we're gonna go ahead and get started. My name's Hillary Hayden. I'm the Executive Director at the Washington Fair Trade Coalition, and I'll be moderating today's event. In a moment, I'm gonna introduce Matthew Rose from Health Gap, James Pfeiffer of the University of Washington's Department of Global Health, and Audra Gallegos, who is a Seattle public school teacher. After they've each spoken, we'll be taking some questions, but before we dive in, I just wanna start with a few words about why we're here today. Back in the spring, when COVID vaccines were first becoming widely available across Washington State, a lot of folks believed that the state had turned a corner on COVID-19. The talk back then, although I'm constantly reminded that this is not a real public health term, was of a hot back summer. Students and parents were going to look forward to a normal fall. People thought we were putting COVID-19 behind us. And instead of a return to normalcy, our state, like the rest of the world, was slammed by the Delta variant. Infection rates that had been trending downward spiked back up. Hospital beds started filling again. Children and young people increasingly started becoming sick, and a lot of folks died. The Delta variant that has undermined so much of the progress we've made domestically against the coronavirus is the direct result of lack of COVID vaccines and treatment access in low-income countries around the world. This ongoing vaccine inequity is obviously devastating to families and communities abroad, and that's reason enough for us to work to end it, but it is a real threat here at home as well. Recently, folks have begun talking about Washington rounding a corner on the Delta variant, and we're here today to warn that Washington State will remain vulnerable to wave after wave of COVID variants unless and until less wealthy countries throughout the world have access to COVID vaccines and treatments. Political leaders have often said throughout the pandemic that no one is safe until everyone is safe, and that's not just a nice soundbite, it's really the truth. And it's time for the US government to help rapidly expand vaccine and treatment production around the world so that there are enough medicines to go around to end the pandemic. In particular, we're calling on President Biden to secure a global waiver on vaccine and treatment monopolies, to share the recipes of vaccines and treatments that taxpayers help fund with additional qualified producers, and to get serious about creating and funding a global vaccination plan. The president recently announced a goal of vaccinating 70% of the world's population by the end of next year. And now it's time to take concrete steps to make that a reality. Donating vaccines from a number of existing production facilities isn't going to help meet global need, particularly as the US and other countries start demanding more doses for booster shots. More than 3.5 million people have died since South Africa and India led the world in asking that pharmaceutical monopolies for COVID vaccines and treatments be waived a year ago this month. Our state will remain at risk until we deliver on the promise of sharing vaccine and treatment technologies and getting shots into the arms of everyone who needs them. At this time, I'm going to introduce our first speaker, Matthew Rose, who's joining us from Health Gap. Go ahead, Matthew.
First of all, thank Hillary and the great organization she runs. As a person who grew up in Washington State, always a point of pride to me to come back and do things with my home state. But as you know, Health Gap has been on the forefront of actually the HIV fight for many years. But in doing so, we learned really important lessons about what it takes to fight pandemics and what it means to end a pandemic or try to end a pandemic. And I think some of these lessons we're trying to bring over to the COVID side. But I think that we're at a place right now where we have to look at some really stark realities. So first of all, the mechanism we thought we could share global vaccines, COVAX, was supposed to get 20% with upwards of 31% of the world's population of low and middle income countries covered by the end of this year. It's nowhere near that. The Biden administration has asked for 40% by the end of this year. We're not going to make that marker either, and 70% by next year. We keep saying that we can make these marks of getting 70%, but 70% was the mark when we thought we only had to give you 2 doses or 1 dose, depending on the vaccine. But in a world where declining immunity is still a big question, as constantly remind people, one of the nastiest things about COVID is that we don't know it historically. SARS-CoV-2 has only been with us since November 2 years ago. Right, that's right, it turns 2 in November. And we still have no idea what durable immunity is going to look like. If we have to give booster shots and maintain a percentage of about 70% vaccination status throughout the world, we are woefully underwater on that question. Now, we've given almost 4 billion shots as a globe at this point, and that's great, except for the fact that we need to get to about 14 billion shots to get where we need to go. We said the United States is making great progress on this effort, and admittedly, we have given or donated about 190 million vaccinations. The problem is when you're trying to get to 14 billion, you have a little issue there. And even the president's own administration has begun being more critical and more serious about trying to get a TRIPS waiver passed. Just recently, the deputy press secretary said she called on the whole world to join us in our move to get a TRIPS waiver done by this ministerial that's coming up in December. The question is, will Germany and the UK and Switzerland move out of the way? With the majority of the country, or rather the majority of the world on our side, it is really a question of these two countries. Can we do enough on the bilateral fronts to push them in directions that is helpful? But while everyone's talking about vaccines, I want to get you really excited about treatment. Now, molnupiravir, which is named after Thor's hammer because Merck wanted to be kitschy, is a great new product, but it's in the small molecule vein, which is a place where we actually have a lot of experience making small molecules and delivering them around the world, ergo the entire HIV pandemic and what we did for that strategy. We know that the strategy can work. We also know that it's likely that Pfizer will also produce a small molecule drug. And if we finally get off our butts and remove some of these trade-related barriers, we can allow for diagnostic testing to happen at cheap rates where you can actually pursue a test and treat strategy. It would allow people of all sorts of different work styles and workplaces to be able to test. And when someone tested positive, you could immediately give them in their home access to treatment drugs at affordable rates. Now, this would be amazing for breaking through the pandemic and something that the TRIPS waiver could work on right now, even as we're building up the critical capacity we need on vaccines. So we know what's there. We know why it matters. But what does it mean to people in Washington? Well, one, Washington State remains one of the capitals of trade on the West Coast. With so much stuff moving in and out of the ports, and we've seen what happens with disruptions in supply chains have caused. Everyone in the country is feeling kind of the grind of inflation caused by just delays in the supply chain. To get that back on track, we have to get the virus on track. And the only way to do that is to make sure that we aren't concerned and worried about another variant. And people are like, but Matt, we're moving the corner on Delta. And like the other variants of concern or variants of interest aren't that bad yet. I'm like, yeah, that's real cool. But what I will remind you of, as long as the virus is allowed to stay out there and mutate in human bodies, you risk variation. Why? Because that's what viruses do. They go mutant. But worst of all, for a variant to be the next big variant around the globe, it has to be worse than Delta, more infectious than Delta. So right now we sit in a unique moment where we can scale up and do something that will actually give us a platform that will allow us to put the tools in place in other countries so they can protect themselves, and by doing that, protect us to truly transform where we need to be in the pandemic. If we want to turn the corner, we have to hit the goal of 70%. And we can't wait till the end of next year, because in doing so, we prolong pain, suffering, and economic devastation. All of these things mean we've got to do the right thing, and we've got to do it right now. Thank you so much.
Thanks so much for joining us, Matthew. Next, I want to introduce Audra Gallegos. She's a public school teacher from Seattle. Go ahead, Audra.
Hi, thanks for having me. I'm really just talking more about what's going on right here at my school. I'm Audra. I work at Lawton Elementary School in Seattle. And I was really, really excited back in March. All of my colleagues and I, we immediately went and got vaccinations when we were approved. We could not wait to get back in the building, back in school. By the end of the year, we thought definitely by fall things would be back to normal. And because of the Delta variant, that hasn't happened. We are technically in school. It's a very different school day than it used to be. We have lost so much that we still don't have back. We're no longer a community gathering place. The last several years in public schools and in Seattle, we've been focusing on the social emotional core of students and our connection to community. That is gone. We can't have anyone in our building that doesn't work here or go to school here. There's no parent volunteering. There are no clubs. I'm the parent of a high schooler. They're not doing plays. They're not doing all of those things that make the childhood experience of school what it is for students. No field trips, all those things. We have a substitute shortage because a lot of our substitute teachers are older and they're nervous about spending their day, particularly in elementary school, with unvaccinated students all day. So it's causing major disruption in our staffing, which always goes back to students not getting what they need. Not only have our students not been really getting what they need academically, socially, emotionally, the students coming in this year, you know, the youngest ones have not been ready for school, meaning not just that they don't know basic academics that they might know coming in, but they struggle with being in a space with lots of other people and knowing, you know, how to behave in just a way that they haven't been around a lot of other kids. So it's really harmful for our students and our children to keep going around with this. It feels like it should have been over long ago. And as long as we don't have vaccinations throughout the entire world, it is going to be this cycle. We have lots of students who are from other countries and parents who travel internationally. This all comes back in, and so we're really concerned about that. I did also just want to mention there's lots and lots of focus on academics, but I just really want to leave you thinking about the social emotional state of our students and of our school staff and how this continues to wear. Thanks for having me.
Thanks so much for joining, Audra, and for sharing your experience. I'm getting a little feedback. It might be good for folks to mute if you're not already muted. But the last person I'd like to introduce before we take questions, I want to note for folks, you can put questions in the Q&A and we'll answer them right after we hear from James. So go ahead, James, University of Washington's Department of Global Health professor. Go ahead.
Oh, thank you so much, Hillary, and thanks to the Washington Fair Trade Coalition for organizing this. Thanks especially to Health Gap for all the work you've done over many decades, especially around HIV. It's great to see Matthew here, and thank you, Audra, for doing all your brave work in our schools. Just briefly, I'll just mention here at University of Washington, where I teach courses, and I'm a professor in the Department of Global Health. It was quite controversial, our opening where this is the first quarter we've been open in the last year. And some courses are hybrid. Most of them are supposed to be in person. I think people are quite happy to be back in person in many ways. You know, everyone has to wear a mask. Everyone should be vaccinated, although the verification process is still underway for that. But there's just a sense of a kind of a wet blanket on the whole experience, to be frank. People are demoralized to some extent, glad to see each other in person where possible. But it's really put a damper on higher education. So I think from where Audra sits all the way through to, graduate school programs, we're just seeing that kind of a terrible dampening effect on our educational mission. Having said that, as a global health person, I'm very involved in work in Africa and parts of Asia in my own work, and I'm executive director of a group called Health Alliance International. We have ongoing projects in Cote d'Ivoire and Mozambique and East Timor. And I just want to kind of build on many of the key points that Matthew made. You know, the term we're using now around the vaccine disparity in the world is vaccine apartheid. It is very much racially segregated. People of color in the global South are getting vaccinated at a much lower rate than those in the wealthy North, in Europe and North America, for example. And in Africa, we're talking about maybe 2 to 4% across the continent being vaccinated now, with very little hope in the future to really budge that number up much. We know that COVAX, which many of you have certainly heard of, is just not even remotely close to getting to where we need to get. As Matthew mentioned, we're talking 14 billion doses, vaccines at least. And so we have to expand production. And part of that expansion is getting a waiver of the intellectual property patent rights that commercial pharmaceuticals have on these key vaccines, the mRNA vaccines especially. getting that waiver and getting the tech transfer agreements in place and getting funding in place so that firms across the regions where have the lowest vaccine rates in Africa, Asia, and parts of Latin America can produce their own vaccines. And there's a very important piece in the New York Times that came out on Sunday, an investigative reporting that showed that there are at least 10 firms that could quite easily, with support, ramp up quickly to begin producing. So the pharmaceutical industry would tell us that there isn't capacity in the global South to do this appropriately. This is exactly what they said during the struggle for AIDS drugs in the 90s, that the generic producers in India and Brazil and South Africa could not do it, could not produce quality medications. Well, that was untrue. And we know that that's untrue now. There are firms all across the global South, at least 10, probably more, that could pick this up quite quickly and begin ramping up production. This is a real struggle. And like the AIDS drug struggle of the 1990s, it has to be a social movement. It has to be global, and organizations like Health Gap and the Fair Trade Coalition are helping to lead the charge. We need others to join them. And Seattle is a very, very important node in the global health world. With the Gates Foundation here at University of Washington, Seattle is a major, major hub. And we need to speak out here. We need to pressure our senators, Murray and Cantwell, to lean in and to push very hard for a waiver, and to push the Biden administration, as Matthew laid out, to really be pushing Germany and Switzerland and UK to get on board with a waiver. There is the WT ministerial meeting starting on November 30th, which is potentially one of our last opportunities in the near future to get this done. And the WTO director has said she wants a decision by then. Now is the time for people in Seattle and people in the global health community in Seattle, but also citizens here, to lean in and to pressure our elected officials to do the right thing and push for a waiver as hard as they can. This is both a moral issue, but also a very self-serving one. If we don't get that vaccine coverage, as Matthew so clearly laid out, we are going to have new variants, right? They are going to come, and we'll be back to square one potentially. So we need to get this done. This is a social struggle in many ways against the power of the pharmaceutical industry and their army of lobbyists. So it's going to be citizen action like it was with the AIDS struggle. And advocacy organizations, which we need to band together and speak forcefully and make this happen. Or Audra is, in 2 or 3 years from now, Audra's going to be sitting with the mask on, telling us the same story. I hope that that message is going to go out, and we need to fight. And right now, the next month is the time to engage and push and put the pressure on. Thanks.
Awesome. Thank you so much, James. So we're going to go ahead and start with Q&A. I want to remind folks you can put questions in the Q&A section, and we'll read them out and have folks answer them. And I think that Matthew or James, you're probably the right people to take this first one. So I'll read it and you can chime in on the pieces that you want to chime in on. The question is, what are some of the largest obstacles and barriers to increasing global vaccination rates in regions that are disproportionately under-vaccinated?
Yeah, so at this point, it is really about sharing technology and sharing recipes and sharing trade secrets. You have to do the trade waiver because you need to get through the patents on the drug itself, but also the industrial design things around it and how it works. The WHO actually set up a tech transfer hub in South Africa to do mRNA vaccines. And they said without support from Moderna, it would take them a year to get the facility up and working. Then Moderna's former chief chemist said you could do it in about 3 months with tech transfer support. So it's really about getting people to do this. As you heard earlier, as James mentioned, there are a number of labs and places that could do it, but it's about having the people who set them up and clearly the companies just can't meet the needs themselves. They're behind on orders literally everywhere.
Yeah, I think Matthew said it really well. Just to back that up, the main barrier, to put it even more simple terms, the main barrier is the pharmaceutical industry clinging to their patent rights. And until we can break through that, it's going to be very hard to really see major increases in vaccine production of the kind that Matthew laid out, the kind of billions of vaccines that we need to produce in the years ahead if we're going to beat the pandemic.
Awesome. Thank you both. I don't see any other questions in the Q&A. I'm going to wait just a second for folks in case there's any other questions people want to ask, or follow-up questions for Matthew and James. Awesome. So if folks don't have any other questions, I think we'll go ahead and wrap up for today. But thank you all so much for being here. Thank you, Audra, for joining in the middle of your school day, and James and Matthew for making time to be here. We really appreciate it, and we hope that this will help nudge us forward in getting some more global vaccine access. Thanks, everyone.
Thanks,
Thank you.
everybody. Take care.